doctor.
Ranging from slightly noticeable to extremely severe, eczema is the broad name given to a number of conditions that affect the outer layer of the skin. It is most prevalent in children.
Jordan was about 18 months when I first realized something was wrong. She was constantly itching and she was always crying. I thought it was skin rash at first, and then I took her to the doctors and the doctor said no, it was eczema.
It's not nice to have eczema because it's really irritating, and if you scratch it, it gets badder.
Eczema resolves itself by age 3 in about half of all infants who suffer from it. In others, the condition becomes a lifelong struggle.
The word eczema means to bubble out or to effervesce, and it can be interchanged with the word dermatitis, which means inflammation of the skin, which can have various presentations depending on whether it's acute or chronic. Now, in the early phase of an eczema, of course, you get intense itching and sometimes burning, and if it is very acute, you find that the skin actually gives off a serious fluid and it can crust. Atopic eczema is not curable, but it can be controlled. Patients tend to outgrow the condition, and about 70% of children will outgrow atopic eczema by the age of 13. But the itching is really the most critical aspect. First of all, one needs to emoliate the skin, moisturize it properly, because a dry skin is an itchy skin. And then secondly, one can use antihistamines.
Many people who suffered from atopic eczema as children experience unexpected flare-ups as adults.
So doctor, I was wondering if you could tell me what would cause the recurrence of my eczema. It started when I was a baby, it went away when I was 18 months, and then from the age of 25 it came back with a vengeance.
Atopic eczema is a genetic condition, and your eczema has just been genetically programmed to recur at a later age. But one also has to look at other factors that could possibly play a role in bringing it back again. And I'm talking about things like stress and the environment.
Could you tell me why emollients work better than moisturizers?
One of the main problems in atopic eczema is the fact that the skin barrier function is compromised. In the old days we used to use plain petroleum jelly, but nowadays we tend to use emollients because not only do they humidify the skin, but they also cause the skin to become more soft and subtle. One of the latest innovations is to introduce various chemicals that are present in the skin as part of the barrier, and these include cholesterol, the various fatty acids, and ceramides that are present in products like the Eczema that you see over there.
Do you think there's a correlation between spending time in the ocean? In the last 2 years I haven't done much surfing, where prior to that I had. My eczema has definitely flared up.
Well, Shane, various studies have been done on salt water, and they haven't been found to be very effective as a treatment for atopic eczema. But I can also tell you that seawater is probably better than swimming in a swimming pool that is chlorinated, because that can definitely make your eczema worse.
Some forms of eczema are brought on by environmental exposure to allergens and irritants. Limiting exposure to these can minimize the reaction.
The skin has many functions, and amongst others it protects us from the environment and of course the various bacteria and viruses in the environment. And when one develops eczema, your barrier function is compromised. And although certain allergens of course do play a role, I would say the environment in terms of things that can dry out the skin and irritate the skin is probably even more important in atopic eczema.
Though there is no permanent cure for eczema, the symptoms can generally be managed. A consultation with a dermatologist can help you find solutions that work for you. Cipla will make it better.